My name's Max Feinstein, and I'm an anesthesiologist filming here in New York City at Mount Sinai Hospital. I spend a lot of time providing anesthesia for patients undergoing robot-assisted surgery, but what exactly is the surgeon's experience with robot-assisted surgery? In today's video, I'm actually getting into the operating room with one of the chiefs of colorectal surgery at Mount Sinai Hospital, Dr. Sanghyun Kim. Thank you very much for letting me get into the operating room with you and for sitting down to talk with me.
Thank you for inviting, and I'm very excited to be talking with you about robot-assisted surgeries today.
Ordinarily, when you and I are communicating with each other, there's a drape that's up in between us. So I thought for our interview, it might feel a little more natural if we just put this drape up like this. So
This is great.
Is that a little better?
So this is the blood-brain barrier
Exactly.
we try to create. Yes.
So let's start with the basics. What is robot-assisted surgery?
We're not using nanobots. We're not having a little robot that we put inside the belly to do the surgery. It's basically almost same as laparoscopic surgery, in which we put a bunch of little straws in the abdominal wall and through which we put robotic arms. And the huge advantage of robot is that we have an amazing view, and the surgeons are actually sitting a few feet away from the patient in a console where we're immersing ourselves into a device that gives us the view, and we remotely control the arms that are inside the patient's abdomen. So very similar to laparoscopic surgery, but better instrumentation with better devices.
How exactly do you control the robot at this console?
The robot console that we're sitting in has finger control that also gives us a wrist control of the robot instruments. And we use our foot to control different exchange instruments, change cameras, control cameras. And all the movements that we do in a console gets translated into the motion at the robot arm portion, which is on the patient's bedside.
And the arms you can swap out to have basically whatever sort of device you want. Is that right?
Yes, that's correct. It's the very similar looking instruments that we do when we do laparoscopic surgery. So myself too, I've been a laparoscopic surgeon for about 15 years, and last 4 or 5 years, I've converted completely to robotic assisted surgery. So now I use only robot to do abdominal surgeries.
What are some of the advantages of robot-assisted surgery?
It's all about chair, because once surgeons are sitting down in a very comfortable game chair, our body's comfortable, and we have amazing view. But
Dr. Kim, I hate to break it to
Yes.
you, but there's an adjacent specialty that has the luxury of chairs all
Yes.
day long.
Yes, I realize that.
It's never too late.
That's one thing I've been always jealous of in the OR, your chair. But now I get to have my own chair too. But jokes aside, robotic surgery does give much better visualization, and it's also 3D. So it's almost like having our head inside the patient's abdomen and looking at things three-dimensional view, not looking at a monitor as we do the surgery in a case of laparoscopic surgery. And instrumentations also have, again, the jointed wrist and arms. So it's not a straight stick that we're using to do the surgery, but it's actually more like an arm, and that's much more fluid in the abdomen, which gives us much more precise control, better operation, and therefore quicker and better recovery.
What are some of the challenges of performing robot-assisted surgery?
It takes some time and some number of cases to get really good at it. So one has to be a good laparoscopic surgeon before becoming a robotic surgeon. And also, this year I think I'm going to be hitting my 500th case in robotic surgery, but it takes at least 30, 50 cases to get used to the robot. So on top of being trained how to do a proper surgery in the abdomen, you have to also learn how to use the robot and learn the instrumentation. So it's an added training that you have to go through. So that's challenging. But once you go through the learning curve, I think advantage of the robot is tremendous.
One of the conversations that's coming up now in basically every specialty in medicine is the role that artificial intelligence may play. Can you speak to the role that AI may play in robot-assisted surgery?
AI in robotic surgery is going to be a huge thing. That's the next step. Just like when you drive an automated car, it kind of tells you the car in the front, the lanes inside you have to be careful of. So the AI for robotic surgery can be sort of a guide, but very soon I'm sure it'll be pointing out where the cancer is, which area we should avoid and be careful of. Before robot doing the surgery for us, I think AI can be used to make the surgery more safe.
What would you say are the most rewarding aspects of your career as a colorectal surgeon?
When a patient comes in with disease in their colon, cancer in their colon, sometimes the whole family comes up and they're very stressed, obviously. And you sit down with them, go over how this happened, and how we're going to fix it, and what are the steps, and how I would use my robotic instruments and do the surgery for you, and what the recovery period would be like, and actually having the patient go through these steps, one by one. Sometimes it's much easier than patient anticipates, sometimes a little harder than that, but in the end, we can get patients and their family to where they used to be before this tough situation started. And when they come back, post-operative visit, you could see how they've transformed from anxious and stressed out family with problem to someone who went back to their normal lives again. And I think having to see our patients go back to what they used to be with the family, to the family, I think is probably the most rewarding thing that I see.
And on the flip side, what would you describe as the most challenging aspect of what you do?
So it's a very same disease process that I'm speaking of, colon malignancy. In the last 20 years of being a colorectal surgeon, we've seen much more younger patients coming in with more advanced diseases of colon, cancers mostly. It's already hard enough for someone who's old and elderly to have colon cancers, but when we find these diseases in much younger patient population, it's so much harder on the patients, obviously, and also surgeons taking care of patients with this ailment. It's just a bit of a heavy on the heart.
If you had to go back and pick a different career, you couldn't be a colorectal surgeon, what do you pick?
So I have to say, anesthesiology.
Yes. I'll give you, just send me your Venmo information.
We talked about chairs already. So chairs are one thing, but the most amazing thing happens to me in the operating theater, and to be in other specialty where I cannot come into the operating room, where a huge changes in human body happens, that I couldn't do. So I had to stay in the operating room.
What's your favorite medical related TV show?
Yes, I had to binge this show recently, but it's called Hospital Playlist. It's actually a Korean drama. It's about a bunch of surgeons in different specialties working together in the hospital. It is exciting and sort of reflects on what I do, and I thought it was very interesting and fun, especially for surgeons and for anesthesiologists in the hospital. I recommend highly for you to watch it.
How do you feel about Grey's Anatomy?
I don't know. I didn't enjoy the drama portion of the show. I thought it was a little too much. I think in the very beginning they were focused a little bit more on the procedures and science behind it, but later on I thought it became a little bit more of a drama.
Did you see what they show of the anesthesiologist in Grey's Anatomy?
No.
Me either. That's my beef.
I see.
Yeah. I thank you greatly for your time and willingness to sit in front of the camera. This has been very informative, and I really
You're very
appreciate
welcome.
it.
And this was fun. Thank you.